Hello, welcome back to my YouTube channel again today. This is Dr. STM bringing you news from the health industry for this month, August. If you're new to my channel, hey, you've been missing a lot. Subscribe to this channel, turn on the notification bell, and if you've been here, thank you for always hanging out with me and always doing what we do here, our health news, stories, interviews, topics, tips, and the rest. Thank you once more. Today, I'm bringing you news that heralds around outbreaks, fights, growth, innovations, and several other announcements. Stay tuned as we come back from this. From outbreaks, Cote d'Ivoire declares the first Ebola outbreak since the year 1994. The patient is said to have returned from Guinea. And sequel to that, they have decided to start vaccinating their health officers, especially the frontline workers. In our country, cholera is still on the increase to the extent that it has affected 23 states. The only language cholera understands is good hygiene, shun contaminated water and food, and maintain optimal hygiene. And the moment you notice any funny symptoms like diarrhea and vomiting, start oral drip and present to the hospital as soon as possible. Then again, World Health Organization has confirmed the outbreak of Marburg disease in Guinea. Now, this is the very first time we are having this disease in West Africa. Marburg disease is as fatal as Ebola, has about the same fatality rate of up to 90%. And just like Ebola, the best thing you can do for yourself is to present to the hospital as soon as you notice any symptom. The disease can be gotten by direct contact with infected persons or wild animals, or direct contact with their bodily fluids like blood, saliva, urine, and the rest. In Nigeria, we are happy to also announce that we have commenced the second phase of COVID vaccination, this time using Moderna vaccines for about 4,080,000 vaccine doses donated by US government. And it's important to know that the Presidential Steering Committee has warned that we should all get vaccinated because soonest one may not be able to process some traveling documents without presenting their full vaccination certificates. Now, about malpractices and illegal practices. 3 doctors have been deregistered by the Medical and Dental Council of Nigeria on account of gross professional misconducts. Some other doctors were punished and some others acquitted and discharged that they are not guilty as charged. Now, these 3 doctors are Dr. Sunday Elusoji of University of Benin Teaching Hospital, Dr. Yakubu Koja in Yola, Adamawa State, and Dr. Oludare in Philadelphia Hospital, Lagos State. Dr. Koji was said to have carried out a surgery that damaged the kidney of a patient who is now dead. In the same way, 2 Nigerian doctors have been dismissed from the United Kingdom on the same account of professional misconduct. Then again, in a single city in Abia State, that is Umuahia, the Pharmacists Council of Nigeria sealed 301 medicine shops out of the visited 394 on account of several offenses such as selling drugs that are not approved, selling without pharmacists, bad storage system of their drugs, and the rest. And this is just a single city compared to what we have in Nigeria. In the same way, NAFDAC has sealed 38 water companies in Sokoto State. And the coordinator of NAFDAC in same states, Adamu, said that they are going to make sure these people are punished according to the NAFDAC guidelines until they get registered and do it accordingly. Still under illegal practices, the United States Federal Bureau of Investigation has arrested a Nigerian doctor, Patrick Wohu, and his associates over a multi-million-dollar fraud. They've been allegedly said to certify nursing students from a school that has been closed since 2008, giving fake transcripts and certificates to about 175 students so far. And these students are made to pay about $6,000 to $18,000. Now, let's talk about association fights and strikes. The National Association of Resident Doctors commenced their nationwide strike since 2nd August on account of unpaid entitlements and strikes. Even sequel to this, they are angry that the federal government, instead of finding ways of resolving the solution, is busy taking them to court. According to them, they were in court on the said day, and the court was adjourned till 15th September. Later this month, on 23rd of August, the court ordered the doctors to go back to work. However, doctors said no, they are going to continue the strike until government does what they request. The government has now mandated its chief medical directors to immediately start the no work, no pay policy. In the same way, the Medical and Dental Consultants Association of Nigeria, who intended to start their own nationwide strike on 16th August, had postponed theirs to next month by 4 weeks, hoping that they could engage the necessary bodies before they take on this action if these bodies do not do what is required. Reason for strike is still on the same unpaid entitlements and setting under surgery issues. They have equally said that they have tried to engage these people and negotiate to peace for the past 10 years, and no solution has been gotten so far. Well, let's take the story now to two major associations housing radiographers in Nigeria. These associations are Association of Radiographers of Nigeria, ARN, and Medical Imaging Society of Nigeria, MISON. The duel is said to have taken a different direction when one of their professors, Professor Anthony Ugu, took their case to court. It was said that first, these associations, ARN, was open to house radiographers who have diplomas, while MISON was open to house radiographers with degree certificates. However, the issue went abroad when Professor Ugu accused the Radiographers Registration Board of Nigeria of certifying technicians to practice as professional radiographers, and because many MISON members who are degree holders frown at this, they all backed alongside with Professor Ugu, who now took the case to court. And as we are speaking now, the case has been petitioned equally to National Assembly. Talk about when two siblings are fighting at home. Now about innovations and growth. University of Benin Teaching Hospital is happy to inform everyone that it is now the second hospital in Nigeria to have the cobalt-60 high-energy brachytherapy machine, which is usually used for treating women with gynecological malignancies such as vaginal cancers, cervical cancers, endometrial cancers. It is quite an applaudable one, and we think the government should even put in more efforts to see that many centers have this machine. In the same way, NAFDAC is saying that it is targeting to commence local production of COVID-19 vaccines by the year 2022. And not only that it is targeting to commence this, that it is currently trying about 3 herbal products for the treatment of COVID-19 disease. That's quite interesting. Now information from Nevin Healthcare. 29th September is the World Heart Day. And Nevin Healthcare is letting us know that they are offering discounted cardiology investigations. And if you book with them before 1st September, you can enjoy free cardiology consultation. Don't lose this opportunity. Care for your heart. Now back to our discussion again. In Sokoto, they have given new anti-rape law. This time, it doesn't just cover rape, it also covers female circumcision and people who abandon their spouses or their children. The law states that whoever commits rape is liable to 21 years imprisonment or more, provided the offender is up to 14 years. And in a situation where it is a gang rape, all the offenders are liable to 25 years imprisonment with no option for bail. And then again, anyone who circumcises a female is liable to 4 years imprisonment or a fine of 200,000 naira, or even both as the judge considers. And lastly, one who abandons a husband or wife or children without any form of sustenance is liable to 3 years imprisonment at most, or a fine of 500,000 naira, or both. On a sad note, on 20th August, UNIZIK went wild with the news of a student who committed suicide in his hostel. And this goes back again to the global report about Nigeria's ranking on mental health matters. Nigeria ranks 7th amongst all the nations in the world with high caseloads of mental illnesses. And still on that, we rank 15th in suicide-related causes of death. But amidst all these things, we have barely about 150 psychiatrists. And then, triggers are here and there. The little we can do is to speak out and be more kind to one another. Then, from Calabar, the University of Calabar Teaching Hospital has suspended internship for health professionals. They said this was done on security reasons following the 2 times protest by the health interns. And the interns said their protest is solely because they have not been paid their salaries for 10 months, while their counterparts who are doing house job, that is the medical doctors, keep receiving their salaries promptly. Now, from Enugu State, the governor of Enugu State, Governor Ugwanyi, has announced an increase for health professionals under the umbrella of Joint Health Sector Union, JOHESU, an increase in their salary from 41% to 60% effective from September 2021. Lastly, do you know that men can have breast cancer? Thank you for staying with me to the end of this video. If you're new to my channel, don't forget to subscribe here. I make videos on different health tips, do's and don'ts, health news, interviews and stories, a little about me and many more. It is a place you should not miss being. Thank you and spread this news to your friends, colleagues and family. See you next week.